20 years ago, I was in college, and my grandfather was gravely ill in an intensive care unit. I went to visit him, and he seemed really uncomfortable at the time, and I really internalized that experience for him, and I noticed that I started to become weak, I felt clammy, and eventually my parents had to help me out of the intensive care unit to where I could just recover my own emotional experience of that. Fast forward to today, and I'm now a member of the faculty at Beth Israel Deaconess Medical Center, where I'm in the neuro ICU and I take care of gravely ill patients with neurological problems who can't communicate their needs. And then I'm also part of the Marcus Institute Palliative Care Research Center, and I'm particularly interested in the experience of patients who are critically ill in the intensive care unit. I do that in two ways. The first of which is using very large databases and evaluating how the long-term outcomes of patients can be utilized through places like Medicare and measuring how they do long-term. The second of which is really looking at the 1 in 4 patients in the United States that die in intensive care units. And I'm worried that we do a lot to escalate care, and we have a lot of evidence as to how we escalate care. What we don't know is exactly how to de-escalate care. And when we've reached the limits of what we can provide in terms of life-prolonging therapy, whether we can reassure that the patient's actually comfortable, especially those that are unable to communicate their needs. And that's more often the case, especially in the neuro ICU. And in particular, more often the case with older patients that have complex medical needs. And so right now we have funding from the National Institute on Aging, which would have been impossible for me to obtain without my affiliation with the Marcus Institute. In addition to that, we have pilot studies that are going in, looking at using skin conductance, which is measuring a part of the nervous system that I experienced back 20 years ago with my own grandfather, but whether or not we can actually employ this part of monitoring with a wrist-worn device very similar to a Fitbit, and whether or not that can actually be used as a marker for discomfort at the end of life. These and other methods will be employed to really help innovate and advance the process of dying, which is all too common in the intensive care unit, but affects 1 in 4 Americans. And so it's with this that it's my hope to continue to advance the science of those that are critically ill in the neuro ICU, as well as assuring comfort at the end of life. And it's with this and the team that's part of the Marcus Institute that I hope to continue to advance and innovate the future of care of our patients.